A new case of Ebola is in the United States. This one is different, though. The patient was diagnosed in Texas.
Yeah, Dallas Hospital and the Centers for Disease Control confirmed tonight the patient is in isolation. KRDO News Channel 13's Greg Miller is looking at the impact. And Greg, of course, a lot of people have the big question here in Colorado. What's the risk here?
Well, James and Heather, quite frankly, not much of a risk at all. The CDC still says the highest risk for the disease to be spread is if someone travels to Africa, where the virus is widespread. In a press conference earlier this afternoon, the CDC said the Texas patient recognized he had Ebola symptoms and admitted himself to the Texas Presbyterian Hospital. The virus has an infectious period, though, of 2 to 21 days. That is a long time, but the U.S. also has better medical facilities to deal with infectious viruses. Our medical expert, Dr. John Torres, says that's a big reason not to panic.
This was in Texas. It was somebody that traveled from Liberia to Texas, so they're not in this area. And two, they handle them very quickly, they isolated them very quickly, so our chances here are very, very minimal to have any kind of contact with Ebola and certainly to get infected with Ebola.
Now, according to the World Health Organization, more than 3,000 people in West Africa have died after being infected with Ebola. According to the CDC, Ebola causes viral fever, which can affect multiple organ systems in the body and are often accompanied by bleeding. In the Newsplex, Greg Miller, KRDO News Channel 13.
All right, Greg, thanks. And Fort Carson is sending 160 soldiers to Africa to help contain the Ebola virus. Those engineers will deploy late next month. Their primary mission will be to put together Ebola treatment units that will house patients and doctors. The U.S. is also working to train healthcare workers, as many as 500 per week, to help deal with this outbreak.